Alright, hi, my name is Brittany. I'm going to be doing a head and neck assessment on my patient here. Can you start by telling them your name?
Lisa Bruffy.
Alright, so you want to gather your supplies. So I've got a pair of gloves, hand hygiene, and my otoscope. So I'm going to start by doing hand hygiene. You want to always provide patient privacy. Alright. So I'm going to start by looking. Her condition is good. Her clothes are clean. She's not disheveled. Her clothes are appropriate for the season. It is hot here in Louisiana, so it's appropriate to wear flip-flops. Alright, so there's no obvious signs of deformity. Her affect is good. She is calm, cooperative. Alright, can you tell me your name again?
Lisa Bruffy.
Can you tell me what year it is?
2020.
Can you tell me who the president is right now?
Donald Trump.
Alright, so her level of consciousness is good. She's awake, she's alert, she's oriented. So that's wonderful. So her skin is nice and pink. So that's perfect. That's a sign of good perfusion. Alright, and any trouble swallowing food, eating food, any weight loss?
No.
So that's perfect. So her nutrition status is good. She's not anorexic. Her eye contact is good. She's able to follow me as I move around the room. She's able to keep focus on me. So that's perfect. Alright, so I'm going to start by inspecting the scalp. So I'm going to be feeling her head. There's no obvious masses or deformities. Is any of this painful?
No.
So I'm going to look at her hair. There's no obvious signs of hair loss, so her hair is good. It's not brittle. Alright, and then I'm going to be inspecting the cranium. So I'm going to start with the frontal, the temporal, the parietal, and the occipital. Alright, and then I'm going to move to the temporomandibular joint. Can you open your mouth and close? Any pain with that? So no obvious signs of TMJ, no dislocation. It's not painful for her. Her face is symmetrical. Her eyes aren't drooping. Her mouth isn't drooping. If there was any drooping, obviously that would be signs of a stroke, possibly. So I'm going to feel her temporal artery. Temporal artery is good and strong. I'm going to be feeling your sinuses, okay? So we do these. Is that painful at all?
No.
So there are frontal and maxillary sinuses. Is that painful?
No.
So our sinuses are good. So I'm going to move on to her eyes. We're going to do a few different eye tests. So I want you to look at me without moving your head. I want you to follow my finger. Perfect. That's awesome. All right, and then I want you to close one of your eyes. Put your hand over one of your eyes, and I'm going to show you some different numbers, and I want you to tell me what they are without moving your head.
1, 2, 3, 4.
That's perfect. And you cover the other eye.
1, 2, 3, 4.
Perfect. All right, that was the confrontation test. And then the first one that I did was the 6 cardinal phases. It measures the cranial nerve 3, 4, and 6. All right, so the corneal light reflex, you would use an ophthalmoscope. I do not have an ophthalmoscope for this exam, but I'm going to go ahead and use my light. But for the corneal reflex, you would shine a light on the patient's eye, and you would see a bright cornea. So it's a little hard to see without the ophthalmoscope. You can also do a red reflex test, and what that is you would want the room to be dark, and you would shine the ophthalmoscope light into their eye at a little bit of a distance. You would be able to see a red reflex, and you would follow that red reflex all the way close to their face, and you could see the inside structures of their eye. All right, so I'm going to start by inspecting her eyes. So there's no obvious signs of abnormalities, no trauma. Her eyebrows are good, no hair loss. So I'm going to pull down and look at her conjunctiva. It's nice and pink, so that's perfect. I'm going to look at her sclera. This is the white part of her eye. There's no redness. Your eyes don't burn or itch. Okay, perfect. Then the iris is the blue part of her eyes. Her eyes are blue. And then her cornea is this outer clear part, and there's no obvious signs of tears or injuries to the eyes. Her pupil size. Her pupils are approximately 3 to 4 millimeters in size. They are equal and reactive to light and round. All right, I'll have you look at my nose and then look behind me and then back at my nose. So her pupils do accommodate, so Perla is present. All right, and we are not going to be using a Snellen chart today, but how you would use one is it's the chart with the big E, and you would have different lines of different letters to read, and each line represents a vision. So there's a 20/20 line, 20/40, and etc. So you'd ask the patient to cover one eye and read the smallest letters that they could read clearly, and then do the other eye and then both eyes together. But we won't be doing that today. All right, and then I'm going to go on to your ears. So you want to inspect the ears. Make sure there's no obvious signs of deformity or any trauma. Her ears look good. So I'm going to take my ophthalmoscope and look in her ears. So for an adult, you want to pull the ear up and back, and then gently slide the ophthalmoscope in. Her ear looks good. I can see the tympanic membrane. It is nice and pearly, which is good. There's no redness. And this one, pull up and back. I can see the eardrum. It's pearly, which is good. No signs of drainage. All right, I'm going to do the whisper test. So I'm going to cover one of your ears, and you're going to repeat the word back to me.
Banana. Apple.
Perfect. So she can hear really good. That's awesome. All right, so I'm going to move on to the nose. So you want to look for symmetry. So her nose is symmetrical. There's no obvious signs of trauma or injury or deformity. I'm going to look inside her nose. You don't want to stick your scope in too far because the nose is very vascular and it will bleed. No deviated septum. Her turbinates look good. Nose looks good. All right, so I'm going to move on to her mouth. I'm going to go ahead and put on my gloves. All right, if you'll open your mouth for me. So I'm looking at her gums and her teeth and her soft palate and hard palate. It looks good. So her buccal mucosa looks good. It's not significantly red. It's not swollen. Her teeth, there's no obvious signs of broken teeth. Her gums are nice and pink. There's no significant redness or swelling. The floor of her mouth looks good. There was no problems with the floor of the mouth. Her hard and soft palates look good. I'm going to look at her uvula. There we go. So her uvula looks good. There's no significant redness. It's midline. It moves appropriately. Her tonsils are a grade 0 because she had a tonsillectomy as a child, so there's no tonsils to do an assessment for. All right, so I'm gonna have you open your mouth and say ah.
Ah.
Perfect. All right, so that's good. And can you stick your tongue out? All right, awesome. All right, so I'm gonna move on to her neck. I'm gonna go ahead and take off my gloves. So we'll move on to her neck and just kind of inspect and feel any trouble, any pain with that. There's no masses, no deformities. There's no jugular distension. Jugulars look good. All right, so I'm going to start feeling her lymph nodes. So I'm going to start with the preauricle, which is right in front of the ear, the parotid, the submandibular, the tonsillar, the posterior auricle, which feels good, the occipital, which feels good, the superficial cervical, and have you turn your head. The deep cervical are deep, so you probably won't be able to feel them, and I can't feel hers. So you can turn your head back to me. All right, and then I'm going to look at the posterior cervical. Good. No signs of swelling or pain. And then last but not least is the subclavicular. So these right here, or supraclavicular. Those all feel good. No pain?
No pain.
Okay, great. So I'm going to feel her trachea. Trachea is midline. I'm also going to feel her carotid pulse. Pulse is good. Strong on both sides. I'm going to feel her thyroid. Can you swallow for me? So that kind of brings the thyroid to the front. No swelling with the thyroid. Any pain with that?
No.
Okay, perfect. All right, so I'm going to have you move your head up, down, side to side. Perfect. So she has good range of motion. She has good neck muscle strength. She's able to maintain her head position and look straight at me for this exam. Do you have any questions?
No.
All right, this concludes my assessment on the head and neck.